So I work for the state agency, the health department, Kansas Department of Health and Environment.
Okay.
I work here in Wichita in a district office.
Okay.
So that's a little different because most people that work for KDHE work in Topeka.
Okay, I was wondering, I was like, aren't they normally in Topeka?
Yeah. And the reason I work here in a district office is because a big part of my job is to manage grantees that are receiving KDHE grant money that are in
okay.
this region.
Okay.
So South Central Kansas. So primarily the grant program that I help administer is called Chronic Disease Risk Reduction Grant Program.
Okay.
So I'm going to refer to that as CDRR.
Okay.
Chronic Disease Risk Reduction.
Okay.
So if you remember from your school, the 3 biggest risk factors for chronic disease are smoking, inactivity, poor nutrition.
Okay.
So primarily we work on prevention and cessation of tobacco use.
Okay.
That's the #1 cause of preventable death in the U.S. And my job is primarily funded through CDC tobacco money. So, that's a huge part of our grant program, and it's a huge part of what I focus on.
Okay.
Yeah. So, just to kind of help you understand, I do a lot of things related to tobacco use, but that's not all I focus on. And then, I do education and stuff like that to the community, but primarily I'm supporting grantees to do that work in their communities.
And just getting them all the resources they need to
Right.
do that? Okay.
And providing assistance and oversight, right?
Okay.
Yeah.
That's fun. I bet you're an expert at tobacco now.
I am.
Yeah.
Pretty much.
When you see people smoking, do you just want to be like, don't?
Well, and now, we're dealing with a new concern, which is e-cigarette, Juul.
Oh, yeah.
So those are classified as tobacco products, even though a lot of people and young people don't think of them as tobacco, or
They say
even
they're like
even as
bed
e-cigarette necessarily. They're like, no, I Juul. Yeah, that's what I'm talking about. So, we're getting a new challenge just when smoking rates have really decreased, and we had something to celebrate,
Yeah. And now you're like, they came up with something new.
And that's what big tobacco does, right? So
True.
that's a big...
And they're, like, the vaping, most people do it in stores unless it says, like, no vaping or whatever.
Yeah, so in Kansas, we have a Clean Indoor Air Act, which was enacted in 2010.
Okay.
So that means statewide, you cannot smoke in places generally. There's a couple exceptions, like state-owned casinos. But that was made in 2010, and e-cigarettes only came on the market in like 2008, so they weren't really prevalent then.
Okay, yeah.
And so e-cigarettes are not in our state statute. So, businesses and buildings absolutely can enact their own policy. Kansas law doesn't prohibit to make a stronger policy.
Yeah.
But they do have to do it right now because it's not covered under state law.
Yeah.
So that's why, technically, I don't think a lot of people consider it all the time, but technically, unless the building, the organization has put in their own no e-cigarette policy, then it's admissible.
Well, you just see people walking down in the grocery store and you're like, are you kidding me?
Yeah, I know.
Like,
And that makes me really gets me hot, actually.
I bet. Because it just kills me because I work in a nursing home and I see all of these patients with COPD because they've smoked for years. And I'm just like, come and see some of my residents who cannot breathe and they're on like 4 liters of oxygen, and you'll stop right now.
Yeah, and so what we know about e-cigarettes is that for somebody who is a tobacco user, who's a smoker,
Okay.
it is, better if they transition totally to e-cigarette.
Okay.
They are less harmful than
Okay.
conventional tobacco. But for somebody who does not smoke, like a young person, pregnant women also, but they should not use e-cigarettes because they're not harmless.
Yeah, they're just not as bad as the cigarettes.
So yeah, they have carcinogens, and they're not harmless. So that's our message, But lots of smokers too, they don't transition totally to an e-cigarette. They'll do both, dual use, which gets to be pretty bad too for your health.
I bet.
So that the message is, if you're a smoker and you transition totally to e-cigarettes, that is better for you.
Okay. But overall, you're just like.
But if you're not using tobacco, don't start.
Yeah, yeah. I have a couple of nurses friends. They smoke, and they're, they always get on me how much pop I drink, and I'm like, that is pretty bad, but you are killing your lungs in those cigarettes. Mm-hmm. So I'm gonna stick with my Dr. Pepper, and but it's just like one thing for another. But
well, again, smoking is the #1 cause of preventable death.
yes,
Physical inactivity and poor diet, poor nutrition are 2 and 3. So
it's right there.
Don't pat yourself too much. But
yeah, exactly.
You could say that.
You're like, well, okay.
Okay, and anyway, enough.
Okay.
But I do like talking about that stuff.
Yeah, I bet. So, what made you want to work in the field you were working in, and how did you choose your career path?
Well, I'm a little different because this is actually my adopted field, public health. I used to be a high school teacher.
Oh, really?
Yeah.
Okay.
So,
what made you switch?
Well, just practicality, really. Like I moved to Wichita in 2009, and the economy wasn't very good, and USD 259 was not hiring. They had a hiring freeze. So I couldn't work as a teacher.
Okay.
So I looked for other jobs, and I only started this job 2 years ago, but prior to this, I did something fairly similar, and the skills I use in this job are a lot of my education skills, because even technically my title is public health educator. So
okay.
Yeah.
What was your degree in? Like, what did you teach?
Social studies.
Oh, okay.
Yeah.
Awesome. My mom's a high school teacher. So
Yeah.
it's like she's on her 34th year.
Good for her.
She's ready to.
I'm sure.
She's ready to be done.
It's a great,
Same district.
valuable profession.
Everything.
But it's not rewarded the way it should be.
No, definitely not. So, what is your typical work day or week?
So I mentioned that a big part of my job is to assist the grantees in this region. So almost every day includes something with them.
Okay.
So whether that's, we have sort of maintenance things, like they have to submit progress reports, and we have to have calls, and there's sort of a whole system set up. So whether it's monitoring that progress, getting questions, requests for assistance, sending on interesting looking trainings or webinars to them. A lot of my thought process revolves around how can they further their work plans that they're working on. And just to give you some examples, we know that the more tobacco-free spaces there are, that's, it's evidence-based that makes smoking rates go down. So we talked about how in Kansas we have the Clean Indoor Air Act.
Yeah.
There's lots of outdoor spaces that can go tobacco-free as well. So
Oh.
college campuses.
Okay.
So you go to
WSU.
Wichita State, and you know, they went tobacco-free in 2017.
Mm-hmm.
And that was, you know, in part due to the work of our grantee here in Sedgwick County, who worked for a long time with Wichita State students and staff who are interested in, you know, having a tobacco-free campus. So, you know, her role then was to provide assistance to the people on campus who wanted that to happen, whether that was training, setting up the, what did she call that? The sort of enforcement reminder systems. So there's student ambassadors on your campus that, you know, if they see somebody violating the policy, they go and hand them a card that says, "This is the policy, thank you for not smoking."
Oh, okay.
You know, she helped with the policy language, so she helped, you know, the WSU administrators with the policy language. And so, you know, my role is to know lots about that too, and you know, assist her when she needs it, and send her resources that are going to be helpful to her in that work.
Okay, so it's a lot of computer work, you would say?
I mean, I do a lot of, I do, I am on the computer, but I also get to go to the communities as well, and
That's nice.
you know, attend events. So when you do something like that, a tobacco-free campus or tobacco-free parks, you know, you want that. Lots of our communities are working on tobacco-free parks. It needs to be sort of a big campaign too, right? You have to educate all the people. So that includes a lot of events and you know, educational type things. So you know, sometimes I get to go out in the community and help or celebrate with them.
Which that's fun too.
Yeah,
You
you know,
see.
go to meetings. So yeah, I mean, I'm primarily at the office, but there's not a week that goes by where I would be at my desk the whole week. Do you know what I mean?
That's good that you can get out and you're not just like in an office space,
Yeah.
you know?
Exactly.
What excites you most about your job?
Well, the most exciting part is when the partners or the grantees experience success on an initiative that they've spent a long time on.
Yeah.
So, you know, when the city council finally approves tobacco-free parks after they've been campaigning for it for a year, or, you know, WSU, that was like ongoing for, I don't know, 7
time.
years,
Yeah,
maybe
a long
even
time.
longer. And not, you know, not only WSU went tobacco-free at that time, Friends, Newman, and Wichita Area Technical College, which is now WSU Tech, but they all went the same day, July 1st, 2017.
That's awesome.
So, I mean, that was, like, when you get to celebrate that with the partners,
That's a big success because it's not just one college, it's almost all of them in Wichita.
Right.
That's awesome.
So it wasn't, you know, they did that to, you know, so there wouldn't be any competition issues, right? Like, I'm not going to go here because,
that makes sense.
you know, not that I even think students think about that or do that, but, you know, just
I mean,
they cooperated in that way.
Yeah. Do you feel you make a difference or an impact on people? And if so, what specific area of our population do you affect?
So public health is a lot different than, say, teaching, because when I was teaching, I actually made significant impact in like kids' lives, and I could see it, or they would tell me, or whatever, right? Like it was a one-on-one connection.
Yeah.
Public health is different because, you know, primarily what we do is work to change policies, systems, and environment to affect a large population.
Everybody. Yeah.
And so you don't always know, like, the impact you've had on people.
Yeah.
And you just kind of have to be, like, satisfied with, you know, if smoking rates go down, or, you know, some statistic, or maybe some anecdotes or whatever.
Yeah.
And that's okay. Let me get back on track here. So I do feel I make an impact on people, but, like, again, I'm even one step more removed, because, like I said, the grantees are the ones that, you know, really do the footwork.
Yeah.
And I'm, you know, their support person. Yeah. So,
which can be stressful too, though, because you have all these people coming to you for advice. So you have to give them something.
Sure. And the nice thing is when you have multiple grantees and some of them are working on the same things, you can, like, do some connecting. And
that is nice.
Yeah. And I mean, we have grantees across the state too, so we, you know, part of our program is to know who's working on what and make sure that they're all benefiting from progress, you know?
Yeah.
Anyway, so I do feel I make an impact. It's just, you know, sometimes it's hard to say, like, hey, I did that, because I'm just one player in it.
Yeah, that makes sense. If you could give one piece of advice to someone going down your career path, what would it be and why?
Well, my advice always is to get involved. You know, the reason I actually got into this field and you know, started down this sort of like, I'm kind of a consultant, you know, like, started down that career path is because I had some experience, or I was able to translate my education experience into, you know, I think I can be effective in communities because I have this experience.
Okay.
And I think, you know, students who are looking to go down this career path, they need experience, you know, like, it's really hard to just jump into a position like mine without having any, like, real life experience, I guess. So, I mean, even when you're in, you know, when you're studying, I think it's important to get involved in, like, a community coalition, or, you know, something related to your, whatever it is you're pursuing.
Your field.
And just, yeah, to my advice is to get involved in the community, and then when you meet professionals that are working on things you're interested in, like, make sure you go and talk to them, because they'll want to talk to you, but you have to probably introduce yourself. So just to be, you know, take that bold step, I guess.
Yeah.
Yeah.
And it makes more connections.
Yeah.
You know.
Exactly.
If you had the opportunity to experience your career path over again, what would you do differently, if anything at all?
Well, personally, I wouldn't do anything differently. I really liked being a teacher, and my education experience has been very valuable in this, like, in what I do now. In fact, if you looked at my card, it says I'm the training and outreach coordinator, and that's, you know, I've been telling you what I primarily do, but I also have another role within my staff, which is to help other staff get trained, right?
Okay.
And the reason I got that promotion was, you know, because I have those skills.
Well, that's awesome.
Yeah. So for me, I'm exactly kind of where I want to be. Something that I tell students is that the preferred qualification for my job is Master's of Public Health, which I don't have. So as all you graduate, I'm not sure somebody like me would get this job again. I'm not sure. So you have the education, or you're getting the education, and I would just again reiterate to make sure you're trying to get that experience too. Yeah. So my experience was the equivalent. For this job, but I probably wouldn't get a master's of public health.
Yeah.
If I had to do it all over again, because I feel that my experience is just as valuable.
Oh, if not more.
So. Not that I haven't had to learn, certain concepts, but that's that when you're on the job, you have access to lots of professional development, and that's important to take advantage of.
Yeah. You've kind of touched base on this, but what personal qualities or abilities are important to being successful in your career? Obviously, experience.
Yeah, I think for my particular position, I do have to work a lot with people, and I have that relationship with the grantees where I'm kind of like a coach, or I'm not their supervisor, but I do have to do some supervisory type things. So if they're struggling and they're not making goals, then I have to address that. So you need to have fairly good interpersonal skills for my position.
Yeah.
Because you need to know how to motivate people.
Yeah, and I bet that is extremely hard. How do you see jobs in this field changing your future and others?
Well, if we are successful, we're reducing unhealthy behaviors and promoting healthy behaviors on large scale.
Yeah.
Yeah.
Everywhere. Is there a time or person you have encountered that made a difference in their life or made an impact on yours that you can tell me about?
There is. But when I think of that question, I immediately go back to like past students, or like I said, those ones that I had more a one-on-one connection with. So, it's kind of hard for me to pinpoint something in this in my public health career.
Yeah, that's fine. Why do you think your service is so valuable to our society?
Well, let me try to verbalize this. Kind of touched on it before. Companies that are selling a product for profit are really working it. They're spending a lot of money and doing a pretty good job of marketing whatever product they're selling, like Jewel, right?
Okay.
Or Dr. Pepper, or
Yes.
whatever, right? We always say like, oh, this is an individual's choice, but is it? Like that marketing is really, really powerful.
Yeah.
And so in public health, we have such limited resources, but our service is valuable because we are providing that counter marketing. So,
For the entire state of Kansas, not just one little.
And like in the case of Jewel, for instance, it's sending alarm bells. Like now teachers and parents are getting very concerned, and so our job is made a little easier because they're receptive to our counter marketing. They're asking us, what's this about? And so if somebody's interested, it's a lot easier to relay your message.
Yeah.
So I think that is our major service, is we provide in many ways, that counter marketing.
Mm-hmm.
So we're putting a check on the power of those big companies.
And that can be hard to do.
Oh, it's it's mostly a losing battle.
Yeah.
But like I said, sometimes we win.
Yeah.
I think.
That's awesome.